Hi everyone, welcome back to this channel. I am Miracle Udechi. I am pleased to share content like this on health so that we can build ourselves and build a community of healthy persons. Today I'll be looking at the facts, frequently asked questions on cervical cancer. I'll be sharing a quick guide on the common questions about cervical cancer. Some people have barely heard about it or they really know very little about it, but it's good you listen and follow through this video. I'll show you steps on what to do to prevent yourself from it. Welcome, you're welcome. Please subscribe. What is the cervical cancer? What is cervical cancer? Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. The cervix is like the neck of the uterus. Yes, so the cervix is usually where this cancer affects. So take note of it as we go on. What causes cervical cancer? Cervical cancer is caused by primarily a virus called the human papilloma virus, and this virus is sexually transmitted. Who are those at risk of it? Cervical cancer. Anyone with a cervix is at risk of cervical cancer. Anyone who has multiple sexual partners that has cervix too is at risk of cervical cancer. Smoking habits, those who have weakened immune system are at risk of cervical cancer. But let's remember anyone who has cervix, and the cervix is typical of women because we have the reproductive system, the womb, that has the cervix. So let's take note. How is cervical cancer diagnosed? How can you discover it? First, it is diagnosed through screening methods such as the Pap test and HPV test. A biopsy may also be performed if necessary. All these tests, you go to a diagnostic center, the hospital. In there, they have procedures which they will take. They do endocervical screening, and then they take sample of the cells around the cervix and then take it for test to see. Then what are the symptoms of cervical cancer? How do you know? First of all, if you have cervical cancer, number one, you have abnormal vaginal bleeding, unusual discharge from your vagina, then you have pelvic pain. But the truth is that the early stages of cervical cancer may not show any symptom. They are usually asymptomatic, and that is why the screening is important. At least it should be done for between every 1 to 2 years. Once every 1 to 2 years, just go and check yourself. And these days there are very many preventive methods if you do not have it. As we go on, I will share with you what are the treatment options for cervical cancer. Treatment depends on the stage of cervical cancer and may include surgery, radiation therapy, chemotherapy, just the same way they treat every other cancer like breast cancer and the rest. They also treat cervical cancer that way. It is treatable when it is discovered early. They can treat you and you will go cancer free. So that's why we are making this sensitization. How can cervical cancer be prevented? How will you be able to prevent it before it destroys you? Because cervical cancer has been the cause of many loss of life, especially among the women folk. So we are partnering with the World Health Organization and other health organizations to create sensitization to teach people about this and to encourage them to go for it. First, you go for regular screening, like I said, at least once every year. Then if you are free from it, when you check and you don't have cervical cancer, you can do what they call the HPV vaccination. There is a vaccine, that's that human papilloma virus. They've created a vaccine to prevent it, to immunize people against it. So you take that vaccine, then you practice safe sex. Do not have multiple partners because this virus spreads by that means. Avoid smoking. Cervical cancer is a deadly disease if not noticed on time, but it can be treated and properly, taken care of if it is diagnosed early and managed. Let's share this news. I will encourage you to like this video, share it, comment on the, if you have some other questions that you want to ask about it, please drop your comments. I encourage to hear feedbacks from you and maybe other suggestions of videos you would want me to create. You can drop it on the comment. Also, please subscribe to this channel. I would link other videos to this channel that I want you to see too, that would be of help to you, and let's build a healthy community. Thank you so much.